Okay, so going back to this risk is, should everyone be concerned? Well, or should you be concerned if you are in a certain demographic or a certain age or engaging in certain types of behavior? So it's very obvious here that behavior is a huge indicator right now of whether you're going to come in contact, into very close contact with this virus, meaning that you would potentially be at risk of contracting it. And so the reaction from the left immediately is to tell us that it is bigoted of us to note that transmission of the monkeypox virus right now is more or less contained to gay men, meaning men having sex with other men because it's being sexually transmitted when the men have sex with other men. The United Nations UNAIDS, the AIDS agency, said that noting that is homophobic and perpetuates a racist stereotype, even though this is what I actually laughed reading this because they're calling me homophobic, right? They're calling you racist and me homophobic for recognizing the reality of how this is being transmitted. And yet, this is what they write. This agency said that, quote, a significant portion of cases reported, quote, were identified among gay, bisexual, and other men who have sex with men, with some cases identified through sexual health clinics. Okay, so how is it homophobic and bigoted and racist of me to note that, but not homophobic, not racist, and not bigoted of the UN to note the exact same thing? The exact same thing. Because that's all we're doing. We're just saying, listen, monkeypox is spreading through sexual contact, and there's an outbreak of it in the gay community. You'd think these leftists who claim to be champions of the LGBTQ community, if they actually cared about these people, then they would raise that warning, because you don't want to get monkeypox. I mean, this doesn't look like a nice virus. It looks nasty. And you'd think if you care about LGBTQ people and you know that this is being transmitted right now in gay communities, you'd say, well, maybe you take a step back on the sexual activity until this has died down so that you don't come in contact with it, because we care about you and we don't want you to come in contact with it. But listen to this. Listen to this. This is a leftist named Greg Gonsalves. He's an epidemiologist. He works in epidemiology. This is what his Twitter bio says. I'll just read it word for word. He says, I work at Yale, focusing on operations research, epidemiology for infectious disease. In the real world, been an AIDS activist for 30 years. Okay, an epidemiologist. This is what he writes. He writes a whole thread in which he says, so a thread on monkeypox. I am not an expert on the pathogen, but right now many of the cases are in gay men, and I know something about infectious diseases among men who have sex with men. First, it is not a gay disease, as some people have said. If you are say it is, typo, I think he's saying if you are saying it is, you are perpetuating stigma and ignorance, damaging the public health response to this, and endangering lives. He says the disease spreads by close physical contact, and this is the setting in which most cases have been found in this global set of outbreaks, most likely disseminated via large social events. He says the answer isn't shut down all these parties. Now, when he says events, he's talking, by the way, about this fetish, this gay and fetish festival that happened in Belgium that seems like it was patient zero of this monkeypox outbreak that has disseminated around the world, but it brought 80,000 people from around the world to this event. And then obviously they took it home. But he said the answer isn't to shut down all these parties or tell gay men to stop having sex at them or dancing in close proximity to each other. It won't work. It hasn't worked for HIV or other kinds of infectious disease outbreaks among gay men. He goes, a friend has said this is what we do. Don't panic. Don't stigmatize. Don't suddenly become sex negative. Educate men on what to watch out for and ask people to stay home if they're sick or have some unusual lesion pop up, even if they aren't planning to have sex. He says, if we jump to cancel events and stop having sex, we lose any hope of an effective response later if this doesn't burn itself out. So this guy is Greg Gonsalves is a leftist, and I just cannot get over the fact the answer, he says, isn't to shut down these parties or tell gay men to stop having sex at them or dancing in close proximity to each other. So you are telling me that for the past 2 years, more than 2 years, the past 2 years and 2 months, people all around the world, but specifically in the United States, have been locked down. We've been forbidden to go to church. Our businesses were closed down. We've had restrictions placed on public assembly. We've been masked. There have been vaccine passports. our entire lives at some point. I know that this isn't the case in every city, in every state right now. Some places have opened back up. But at some point in this 2 years, we have been told by the government and by public health officials, by epidemiologists, just like Greg and Solvis, that we have to lock down. It's the only way. We have to stop living our lives. We can't go on dates. We can't go to school. We can't go to work. We can't go to church. We can't go ride a bike on a bike path. We can't go paddleboarding in the ocean by ourselves or go to the beach. We can't even take our kids to the park. We've been told to stop. And yet when it's gay men, now, it's bigoted and it's homophobic and it's racist to tell gay men to stop having fetish festivals and sex with other men until the monkeypox outbreak dies down. This is the radical left. This is the woke left. These are the people who try to tell you that they know best, Absolutely unreal. But the answer isn't to stop 80,000 people getting together for a fetish festival. The answer isn't to stop gay men from having sex with other gay men or even to recommend that they make that choice fully informed. No. The answer is you're not allowed to go to church and you have to wear a mask on an airplane and you might lose your job if you don't get the vaccine that Fauci wants you to get. Absolutely unreal.